Many thanks, Marie, for the great introduction for this particular session. My name is Rebecca Saint-Amour, and on behalf of myself and my colleague Angela Pai, I would like to thank you for attending today's conference session about the Reaching Home Outcomes-Based Approach and the Community Homelessness Report, or what we commonly refer to as the CHR. The recording for today's session will be included as part of the CHR e-course available on the Canadian Observatory on Homelessness Learning Hub, which offers training and resources based on best practices and evidence-based research for Canada's homelessness serving sector. Today's session will be offered in English, but a French recorded webcast will be added to the e-course shortly. The outline of this presentation is as follows. First, we will provide a brief overview of the Reaching Home program and the CHR. For the Reaching Home program, we will review the different funding streams, where the CHR fits in, and how the outcomes-based approach aligns with the overall policy direction. For the CHR, we won't be going into too much detail, but for those who are less familiar with this new reporting tool, you will learn the basics: what the CHR is, who completes it, and when. We will then cover how the CHR supports reaching home communities in moving towards an outcomes-based approach to help prevent and reduce homelessness. If you have questions about the CHR after this session, we encourage you to refer to our CHR e-course on the Homelessness Learning Hub for more information. At various points throughout the presentation, we will hear reflections that communities have shared with us about the CHR reporting process and how they are using the information from their CHRs to further their progress with preventing and reducing homelessness locally. These reflections are organized by the steps that the federal government is supporting communities to take as they work towards an outcomes-based approach. We want to offer our sincere thanks to the communities who shared their reflections with us for the purpose of this presentation and to help inform the next phase of reporting. Okay, let's begin. As you know, the Reaching Home program does not take a one-size-fits-all approach across the country. The program includes 4 distinct regional funding streams, which have different program expectations, as well as 2 national funding streams. For the purpose of today's session, we will focus on 2 of the 4 regional funding streams, the Designated Communities stream and the Territorial Homelessness stream, which fund 56 urban centers across Canada but outside the province of Quebec, as well as the 3 territorial capitals. Only communities funded through these 2 regional streams of the Reaching Home program are expected to meet minimum requirements related to the implementation of coordinated access and of a homelessness management information system, or HMIS, like the Homeless Individuals and Families Information System, or HIFIS. Communities receiving funding under these 2 regional streams are also expected to adopt an outcomes-based approach and to complete a CHR every year, which is the tool we've designed, in part, to help the transition to using data as a key driver in the work to prevent and reduce homelessness at the community level. While Indigenous homelessness streams don't have to meet any of the program requirements I just mentioned, including the completion of a CHR, many areas across the country have designated communities and Indigenous homelessness funding streams that coexist. This creates an opportunity for the community entities and community advisory boards of each stream in these geographic areas to work closely together to implement the Reaching Home program in a mutually supportive way. Also, it is important to note that the CHR is not the same as the annual results reporting that all Reaching Home funded communities complete. Results reporting is about the specific projects funded by Reaching Home. It measures outputs and outcomes for clients funded through federal investments, such as how many clients were given a Reaching Home funded grant to cover an overdue rent payment and the impact this had at the client level. CHR data measures efforts to address homelessness and the difference that these efforts and investments are making at the community level. So for example, how many people were prevented from losing their housing over the last year across the community. In other words, the CHR takes a whole of community reporting approach. It generates data for the entire homeless population, not filtered by funding source. As an outcomes-based program, Reaching Home has clear goals that are measured in part through CHRs using real-time data from a community's list. We will describe what we mean by this in more details throughout the presentation. And in terms of the types of data that is generated for CHRs using the list, the federal government is asking for the cumulative number of people who have experienced homelessness over the last year, total inflows into homelessness and outflows from homelessness over the last year, as well as an update on local progress with meeting reduction targets specific to 5 core community-level outcomes of the program. These outcomes paint a picture of the overall change we want to see. We asked for data about cumulative levels of homelessness over the past year because we want communities to set reduction targets that can help them monitor their progress with driving overall reductions in the homeless population. And we know that some population groups, like Indigenous peoples, experience homelessness more often than others. Because we are looking for an improvement in this situation, we ask communities to set reduction targets to help them monitor their progress with reducing Indigenous homelessness. We ask for data about inflows into and outflows from homelessness because we know that addressing homelessness will require work on both fronts. Work in preventing homelessness before it happens, as well as in supporting people experiencing homelessness to help them find stable and affordable housing for good. In other words, having less homelessness requires that fewer people lose their housing in the first place, and that people who have experienced homelessness in the past don't lose their housing again once they've secured it. To support this, we are asking communities to focus on prevention initiatives and to help people avoid shelter stays where other safe and appropriate options are available to them. And last but not least, we want fewer people stuck in homelessness for long periods of time, cycling through shelters and living on the streets. While communities are expected to work towards achieving these 5 shared outcomes, they have the flexibility to tailor their local community plans and use federal funding across a broad range of eligible activities or expense categories. So, although we have established the framework for what communities should focus on under the program, they have flexibility in how this is done at the local level based on their particular set of circumstances and population. So what exactly is the CHR and what purpose does it serve? How does it help communities to further their progress with preventing and reducing homelessness? There are 3 main things that the CHR does. We are going to walk through them one by one. First, the CHR is the tool that helps communities to self-assess their progress with meeting minimum requirements of the Reaching Home program related to implementation of coordinated access and use of HIFIS to support this new service delivery approach. Second, the CHR is the tool that communities use to report their annualized community-level data to the Government of Canada when they have the capacity to generate it using their unique identifier list or by name list. A unique identifier list makes it possible to measure, share, and monitor outcomes at the community level. Data generated from a community's list is not tied to a specific program. Rather, it is a whole of community account of who is experiencing homelessness right now and their levels of housing and service needs. I will now turn the presentation over to Angela, who will further describe the concept of a list.
Thanks, Rebecca. Given the important role that the list plays with the CHR, we're going to pause our CHR review for a few minutes to take a look at the federal definition of a list and cover how the list fits in the context of coordinated access under Reaching Home. The CHR outlines 4 minimum characteristics of a list. It has unduplicated information for each person or family experiencing homelessness. It is contained in one document or database, and it only includes those who have given their consent to be on the list. For those of you that participate in Built for Zero Canada or work with the Canadian Alliance to End Homelessness as part of the supports provided to you as a Reaching Home funded community, this definition may look familiar to you. This was very intentional. We worked closely with CAH during the development and launch of the CHR to make sure that terms and concepts align. Similarly, for those of you that have reviewed the federal tools released about coordinated access, this diagram may look familiar. It was taken from the Reaching Home Coordinated Access Guide, which is available on the Homelessness Learning Hub as part of the Coordinated Access e-course. The purpose of this diagram is to show the connection between the list and coordinated access. Reaching Home defines coordinated access as a way for communities to bring consistency to the process by which people experiencing or at risk of homelessness access housing and related services within a geographic area. A community's unique identifier or by name list is essential for a quality coordinated access system because it identifies who is experiencing homelessness and has connected with the system in some way. I'm going to walk you through each level of the list to explain its purpose, identifying who is included in each one and why. As you can see, these 4 circles are nested as part of a whole. As you move up each level, criteria to be included gets more specific. The largest circle is aggregate data. It includes people actively experiencing homelessness who have connected with the system in some way, but have not yet engaged with coordinated access. A good example of aggregate data is an anonymous point-in-time or pick count. With pick count data, we know people exist, but we may not have their names or consent to move forward with any service planning. Often outreach workers play a role in engaging with people experiencing homelessness who are street involved and may not be connected with coordinated access, helping to ensure that no one gets left out if they want help with their housing. Once clients are engaged in services, they are always known by name or some other unique identifier. A by name list is essentially a current list of everyone who is homeless that has consented to being on the list. The purpose of the by name list is to work through the list, person by person or family by family, to make appropriate service connections that help them to find and keep a permanent home. For example, clients in shelter are supported to search for housing and then move into their new unit. Once housed, they're removed from the list. The coordinated access list is a smaller subset of the list. It includes only clients who are eligible and interested in the specific housing resources in the Coordinated Access Resource Inventory. For example, a supportive housing program funded by Reaching Home would be part of the Coordinated Access Resource Inventory and only fill its vacancies through coordinated access. Shelter clients who are eligible for a unit in that supportive housing building would be on the coordinated access list while they complete any documentation needed to support the referral. Ideally, there aren't that many steps, and clients can move through the documentation process very quickly. The final sublist is called the priority list. This is the list of all actively homeless clients that can receive an offer for housing and related services right away because there are no additional steps that need to be taken to confirm their eligibility or their interest in these resources. The priority list is used to fill vacancies. For example, when a vacancy becomes available in a supportive housing building, only clients on the priority list can be offered this spot. When we take a closer look at the CHR sections later in the presentation, you may recognize some of the terms like Coordinated Access Resource Inventory and Priority List because several CHR questions ask about them as part of the overall self-assessment of coordinated access implementation under Reaching Home. And now turning back to what CHRs do. Last but not least, given that CHR data needs to come from the community's list, and given the Reaching Home requirement that the list needs to be comprehensive before data can be reported on outcomes through the CHR, the CHR reporting tool provides guidance for how to generate a comprehensive list. For example, in Section 4, the CHR asks communities if their list includes people experiencing homelessness who aren't accessing shelter and may need to be engaged in the coordinated access system through another service like outreach. As you will see in the next few slides, having a comprehensive list is one step in a much broader process of moving towards an outcomes-based approach. Let's take a closer look. There are actually 3 big steps that communities need to take as they move towards an outcome-based approach. The first is to establish an integrated governance structure. The second is to implement coordinated community-level processes, those that make it possible to collect and share community-level data, namely coordinated access and having a list. And the third is to set up processes that support the strategic use of the data that's collected through the list, including setting and monitoring reduction targets for the 5 Reaching Home core outcomes. Let's walk through each of these 3 big steps one by one. While communities are expected to establish governance structures that include representative advisory boards to help oversee the implementation of Reaching Home, called community or regional advisory boards, they have the flexibility and in fact are encouraged to integrate these new roles and responsibilities within an existing governing structure. Doing so serves to strengthen the whole of community approach when it comes to leadership, collaboration, and the work of preventing and reducing homelessness within the local homeless serving sector. In the first 2 sections of the CHR, communities reflect on the implementation of their integrated governance structures under Reaching Home. More specifically, all communities complete Section 1, which includes mandatory questions about current levels of engagement between Indigenous and non-Indigenous organizations, as well as future plans to strengthen these collaborations. In addition, all communities complete Section 2, which helps them self-assess their level of progress with setting up a governance structure that includes community leads for both coordinated access and use of a homelessness management information system like HIFIS. Our first community tip is about this first theme, establishing an integrated governance structure. The quote on the slide reads, "As the community entity, we worked closely with our Community Advisory Board, which includes members from our local Friendship Center, to complete our CHR. The process motivated us to look more closely at our data and talk about what it all means. We reflected on our priorities and the direction we want to take moving forward together. We heard from communities that the CHR reporting process gave them the opportunity to engage in conversations about their list with people who were new to this approach. One community told us that they'd hosted 3 data-focused meetings with their Community Advisory Board to review their list, talking about it in depth, answering questions, and coming to a common understanding of what the data means. This community told us that the time they spent with their CAB ended up being a great investment because it's helped them to move forward with other similar community-level initiatives, given that their CAB also serves as the governing body for their 10-year housing and homelessness plan for the province. We also heard that setting up an integrated governance structure can be more work initially, but once established, the upfront effort pays off. For example, having an integrated governance approach makes it easier for leaders from various sectors, such as the health or justice systems, to collaborate, build stronger relationships, and support each other with things like getting buy-in from their colleagues and shifting policies to be more aligned with the goals of preventing and reducing homelessness. The CHR as a community-level reporting tool fits in well with this broader agenda. Section 2 of the CHR is where communities self-assess their progress with meeting the Reaching Home minimum requirements specific to coordinated access and use of HIFIS or an equivalent existing HMIS. As we've already covered, coordinated access is a service delivery approach that follows an agreed-upon community-level workflow. By definition, it's highly coordinated. Using an HMIS like HIFIS makes it possible to generate community-level data more efficiently as part of this coordinated approach. For example, with the enhancements made to HIFIS over the last year, communities can now calculate chronic homelessness, inactivity, inflows into homelessness, and outflows from homelessness in real time at any time. The community tip on this slide builds on the theme of establishing coordinated, community-level processes like coordinated access and use of HIFIS. It reads, these self-assessment tools, not only the CHR but also the CAEH scorecards, help us to stay focused and prioritize. They remind us what we're working towards, what is required to reach our goals, and how far we've come. We heard that communities don't always feel confident that they're putting their attention on the right things at the right time. Because the CHR and CAH scorecards are progressive self-assessment tools, they provide tailored guidance to communities based on where they're at. The self-assessment tools help communities to make sure that the most important things are in place first, including elements that set the foundation for quality, community-level processes as outlined in the Reaching Home Minimum Requirements, before moving on to other more advanced improvement activities. Given that the CHR questions line up with the CAH scorecards, results point communities in the same direction for next steps. To get the most out of these tools, we also heard that it's important to complete them more often than just once a year. Communities suggested that CAB members get regular updates on data from the list and local progress with the Reaching Home outcomes so that there are no surprises when it comes time to complete their next CHR. Communities also suggest having a diverse range of people involved in completing the self-assessment tools. Communities often found some level of disagreement in how to answer the questions. For example, policy analysts and data specialists didn't always see their community's progress in the same way as staff working in direct service. Or workers from different parts of the system sometimes disagreed with each other about the status of implementation. These discussions helped communities to see where more work was needed to find common ground and move forward with greater unity. Finally, we heard that some communities tie their work plans directly to their self-assessment results, which is another great tip. The CEH scorecards form part of an integrated set of tools, including a work planning template, which makes it very easy to translate the results into concrete, action-oriented next steps. And finally, there is big step number 3, where communities focus specifically on the collection, sharing, and use of their data, including cumulative levels of homelessness, inflows into homelessness, outflows from homelessness, and progress with their reduction targets in the 5 Reaching Home outcomes. Communities that are not yet able to generate community-level data will keep working on their lists so that they will have data to report in the future. Over to you, Rebecca, to share some community reflections and wrap up this section of the presentation.
Many thanks, Angela. The ultimate goal for all communities funded through the designated communities or territorial homelessness streams is to be able to set reduction targets for the 5 Reaching Home outcomes using a comprehensive list that has at least 1 full year of data. Once communities reach the important milestone of having a comprehensive list for a full year, the full CHR report can be completed. From that point forward, communities can shift their focus to monitoring progress with reaching these targets year over year. In our consultations, we heard that having a list changed how communities define success, including not only related to their CHRs, but other reporting tools as well. The quote on this slide reflects this shift very well. One community said, "Now that we have a by name list in place and can report on outcomes, we are leaning into this process as much as we can. Our data dashboard shows us a new picture of what success looks like. It isn't measured by the results of one agency or program. It's about making sure that everyone who is homeless gets housed." Having a list captures data from the whole homeless population, not just from 1 or 2 providers or shelters, for example, making it possible to capture outcomes at the community level. That's not to say that data about how individual agencies are contributing to the broader whole of community picture isn't needed, or that agency-level successes shouldn't be celebrated. It just puts agency-level data and success stories in the context of the bigger picture. Or to put it in another way, community-level data tests the definition of success, shifting from an agency point of view to whole population point of view. We heard that communities are now working to balance these different viewpoints. They may still be collecting data and stories from individual agencies about their work, but they are now also considering what people experiencing homelessness across the community need and how long they have been homeless overall, regardless of their level of engagement with individual agencies. Some communities shared that this new level of accountability has been hard for agencies to accept, especially if it runs counter to their views of how well their organization is doing. Over the last few years, we've watched communities make this shift by setting their intentions on reducing chronic homelessness as a collective effort. We know this shift isn't easy, and celebrating their progress with both how they are working to addressing homelessness as well as any reductions that they achieve is very important. Establishing an integrated governance structure and implementing coordinated community-level processes creates the necessary infrastructure to measure, monitor, and share outcomes at the community level. The CHR is a progressive reporting tool because it guides communities through 3 big steps, helping them to move towards this new approach. And more specifically, Reaching Home funded communities complete sections 1 and 2 each year, which ask them to self-assess their governance and progress with implementation of coordinated access and HIFIS. Once communities are ready to start reporting data from their list, sections 3 and 4 of the CHR unlock for them, one at a time. To wrap up this part of the presentation, I'll leave us with another quote. One community shared with us that the building blocks to implement the Reaching Home minimum requirements and develop a list are all outlined in the CHR. It is a good starting point to build on from there. So we've heard that communities use the CHR and other tools like the CAH scorecards as a way to start a conversation about how things are going. This aligns with our hopes for the CHR as a new reporting tool. When we developed it, we wanted it to line up with other tools that are already being used, and we wanted the reporting process to support local discussions about the overall approach being taken to prevent and reduce homelessness at the community or systems level. It is meant to be a tool that helps communities to keep track of their progress as they move through the steps toward full Reaching Home program implementation. With this in mind, let's take a closer look at the CHR sections. So now that you have the general framework for the CHR, we're going to provide a bit more detail by describing each section of the CHR. For more information, we encourage you to watch the CHR webcasts on the Homelessness Learning Hub, including the detailed question-by-question training webcast that was co-developed with 2 Reaching Home communities, Regina and Windsor, as well as the Canadian Alliance to End Homelessness. You will see a link to those resources in the appendix of this presentation. Now let's start with section 1. This section of the CHR is all about community contacts. For example, the Government of Canada is asking communities to report back on the level of engagement and collaboration that exists between Indigenous and non-Indigenous organizations. Section 2 is where communities self-assess their progress with implementing Reaching Home program minimum requirements under 5 theme areas or subsections. Those include governance, use of an HMIS like HIFIS, access points to service, triage and assessment, and vacancy matching and referral. Over the next few slides, Angela will show screenshots of CHR sections and questions that a community funded by the designated communities or territorial homelessness streams have to address. Over to you, Angela.
Thanks, Rebecca. So in section 2, related to governance, the CHR asks, is there a governance model in place for coordinated access with a lead and similarly for your HMIS? And do all service providers receiving funding through the designated community stream participate in coordinated access? And then for access points to service, the CHR asks 3 questions. The first question is about having access sites available throughout the entire community's geographic area. Basically, this means that people in the area can connect with an access point by phone, virtually or online, or at a physical location. The other 2 questions about access points are about having processes in place to monitor if there is easy and equitable access to the system, and how communities are ensuring that people are not denied access to service due to perceived housing or service barriers. And then there are 2 questions about the process in place for gathering all of the necessary information to make appropriate referrals in the coordinated access system, which we refer to as the triage and assessment process. More specifically, the CHR asks if the triage and assessment process is documented, if it includes an intake protocol, and if the community uses a common assessment tool. There are 6 questions about the community's vacancy matching and referral process. For example, the CHR asks if communities have documented how vacancies are filled using prioritization. The CHR also asks if all the housing resources funded through Reaching Home are identified as part of the Coordinated Access Housing Resource Inventory. The Coordinated Access Resource Inventory is the full inventory of housing resources that can only be accessed through the triage and assessment process of the Coordinated Access System. The CHR also asks if eligibility requirements have been documented for the Coordinated Access Resource Inventory, and if prioritization criteria and the order in which they will be applied have been documented. Then, the CHR asks if the community has a policy or protocol that specifies how choice in housing options will be respected, and if communities have a process in place to deal with referral challenges, concerns, and/or disagreements. And finally, the CHR asks if vacancies are filled using the unique identifier or by name list. Section 3 of the CHR has 10 questions. All of the data that is reported in Section 3 comes from the community's unique identifier or by name list. For example, communities with the list are asked to provide data for each column to the best of their ability for each of the 3 mandatory priority population groups: overall homelessness, chronic homelessness, and people who have identified as Indigenous. The columns refer to inflow and outflow measures of homelessness. The CHR also asks communities to fill in the prior living situations table, which shows where clients came from before they were homeless. This data is about understanding where people were immediately before becoming homeless. So their last housing situation, which is why homeless options like couch surfing, living unsheltered, or staying in a shelter are not included. Section 4 of the CHR provides guidance for generating a comprehensive list. It has 16 questions divided into 3 steps. To help communities self-assess the comprehensiveness of their list, the CHR asks about the use of outreach, if people staying at all shelters are included, and if transitional housing clients are included. It also asks if the list includes people staying in institutions and those experiencing hidden homelessness. Again, because the CHR is a progressive reporting tool, if communities do not think their list is comprehensive, this is where the reporting ends for that year. However, communities with a full year of data from a comprehensive list will be able to complete the full report. They are in a position to report their outcomes and begin measuring their progress year over year. Here's an example of how the CHR asks about outcome data. In this example, 100 people experienced homelessness in the first fiscal year and 90 in the second. The community has set an overall target to have no more than 60 people experience homelessness over a year. Reaching that goal is what the community will focus on between now and 2027-28. As numbers are added, a graph is generated to illustrate the results. Communities shared some examples of how they're using the data from their list. Before we wrap up our presentation, I'll highlight 2 of them. The first example was from a community that's in the process of analyzing their inflow data. The data they submitted as part of their CHR for inflows was really just a starting point. To get the most out of the report and the data from their list, they're doing more detailed analysis. The quote on the slide reads, "We are digging into the returns to homelessness data right now. We want to figure out how often it happens and when, on average, people lose their housing after move-in. We want to make sure that people have the supports they need to stay housed. Our inflow data is helping us to be more specific with that goal." The community that shared this tip with us is currently analyzing their returns to homelessness so they can eventually offer more tailored prevention supports to the right clients at the right time. They're looking for clues in their data that can help them to reduce returns to homelessness. For example, if they see fewer returns coming from certain agencies or certain workers, they're going to explore that further to see what can be learned and applied elsewhere to meet their reduction targets. The second example and last community tip was shared by a community when we asked them, "What do you wish you knew about this work before you got started?" The quote on the slide reads, "I wish we talked more about the inactivity policy earlier. In the beginning, our goal was to get everyone added to the by name list. Now we spend just as much time making the information current and complete on the list. We had to retrain our workers to make this shift." The CHR data that this community is referring to here is their inactivity trend line. More specifically, they're referring to the number of people whose status changed from active to inactive because after a certain number of days they could no longer be confirmed as homeless, and so they were removed from the list. This particular community found that their agencies were doing a great job with referring people to the list. The issue was that the information on the list was not getting updated when clients found housing on their own. As a result, the community had very high numbers of people going inactive, when in fact they were housed. To fix this issue, training was put in place. Workers were asked to document housing move-ins for all clients, not just those they were helping more directly with their housing plans. Workers were also trained to update housing history records when a client that was previously inactive returned for service. Over a period of 2 years, this community was able to reduce the number of people going inactive by 80%. They did caution that reaching this reduction target required effort and resources. They had a dedicated staff role assigned to the list, hosted community meetings every 2 weeks to review accuracy of the list, and developed a new tool called the Monthly Inactivity Tracker to make it easier for workers to confirm who was inactive or recently housed. Back over to you, Rebecca.
Thank you so much, Angela. I sincerely hope that you found this presentation useful and informative. And before we move on to the Q&A session, I wanted to leave you with a few elements that are currently on the horizon to better support Reaching Home communities in their annual CHR process, as well as a reminder. So what's coming up? The CHR report in HIFIS is in its final testing phase, and when released, we will offer training to communities about how the newly released Built for Zero HIFIS report and the CHR HIFIS report complement each other. We will be launching a series of CHR articles in the Reaching Home newsletter as well. One article for each of the steps that the federal government is supporting communities to take relative to adopting an outcomes-based approach. And finally, as a friendly reminder, a French version of this presentation will be posted to the CHR e-course on the Homelessness Learning Hub shortly. Thank you again for your time.